A first STI test usually involves collecting samples, like urine, blood, or swabs from the genitals, anus, or throat, and submitting them to a lab for analysis. The type of tests performed depends on your risk factors, symptoms, and the specific STIs you are concerned about. Results can take a few days to a few weeks, and you'll receive them through a method you choose, like text message, phone call, or in person. Here's a more detailed look at what happens. You'll speak with a doctor or nurse who will ask you about your sexual history, symptoms, and risk factors. Urine sample. This is a common test for chlamydia and gonorrhea, and you can usually collect it yourself. Blood sample. This is needed for HIV and syphilis testing, and you may need to have it drawn by a professional. Swabs. These can be taken from the genitals, anus, or throat to test for chlamydia, gonorrhea, and other STIs. Genital examination. If you have any symptoms, a doctor or nurse may examine your genitals. Your samples will be sent to a lab for analysis. The tests will check for the presence of specific STIs. Results can take a few days to a few weeks, and you'll receive them through your preferred method. If you test positive for an STI, you'll be given information on treatment options, and the clinic may offer advice on how to inform your partners.